I found that nothing in life is worthwhile unless you take risks. Nothing. Nelson Mandela said, "There is no passion to be found playing small and settling for a life that's less than the one you're capable of living."
Is neck pain creeping into your day when you're trying to get your job done? Whether you're checking emails, working on the phone, or leaning over like this, or trying to pick up your kids, your groceries. Today I'm going to teach you 5 surprising causes of chronic neck discomfort. So 5 things that are modifiable that you can do right now to take action on, especially if you're a busy parent. So the first thing I want to talk about is, first of all, is, well, the health of your spine and nervous system. Because a lot of times we end up, guess what? Practicing one of these. This is going to be more ideal. And then we practice one of these, and guess what? We get better at this. So many of the things I'm going to talk about today involve you getting moving more, making some modifiable changes. And of course, I mean, as a corrective chiropractor, I want to know about the health of the spine and nervous system. And yes, you may be experiencing chronic neck pain, but something I want to share with you is that oftentimes we compensate above and below, and corrective chiropractor is looking for proper structure and function of the spine, but also the nervous system. And some of the areas you may feel, some of the areas you may have no idea about. That's why it's so important to get tested to know what's going on and how, well, your corrective chiropractor can help you get more out of life and become more resilient and become a faster responder, bounce back quicker. So let's get in today to 5 surprising causes of chronic neck pain. And I'm going to teach you those right now. I'm Dr. Matt Bradbury, family corrective chiropractor here in Georgetown, Ontario, Canada. And today I wanted to teach you to recognize and become more aware. As the first step is becoming more aware. If you're suffering from chronic neck pain, 5 things that may be surprising causes to you and things that you can take action on today. So here we go. Number 1, if you are looking at your phone doing one of these, or if you are literally sitting there at the computer, well, poor posture practiced over and over again, guess what? That can be one of the causes of chronic neck pain right there. So what I want you to do is, first of all, every 20 to 30 minutes, make sure you're standing up, taking a break, moving around, and ideally getting that standing workstation. If you're on the phone right now, do one of these. Bring it up to you just like this as you watch and tune into our videos. So number 1, guess what? That tech neck or that poor posture, something to be aware of. Number 2 is weak upper back and shoulder muscles. The easiest thing you can do is just get yourself a band like this. Number 1, I mean, you can do the band pull apart, shoulders engaged slightly back. Keep this band easily accessible at your desk. Come across like this, pause. You're going to do 10 to 15 reps, at least for 2 sets, and at least once a day, preferably twice a day, but to help activate those upper back muscles, because your shoulder muscles, your rhomboids, may be getting weaker as we speak, and you're literally starting to do more of one of these. Now, the second exercise I really like is just secure this over here, is have your band secured against something. And what you can do is just practice some rows or some scapular retraction. And all you're going to do is one of these. Focus on keeping your shoulder blades pulled back and engaged. Pause. And then forward. Again, with this, you're going to work in the 10 to 15 rep range. And it should be relatively light, but for at least 2 sets every single day to help combat those weak rhomboids and or shoulder muscles. Number 3, stress, tension. Well, guess what? If you're doing one of these, it's more likely you're going to be telling your brain to be more tense and more stressed. And the more stressed you are, guess what? Your traps, your muscles are probably going to become more tight. And if you're not finding a reason to go exercise or use your body, guess what? Things are going to get built up. Your stress hormones may get built up, and you may be becoming more and more tense. So it's so important, first of all, be sitting up straight or standing, but also focus on breathing, because a lot of times we become chest breathers throughout the day and we don't breathe enough into our stomach. And all I want you to think about is 10 times for this breath work you're going to do. You do 10 times, 4 seconds out, 2 seconds in, and to help manage your stress response when you know things are getting ramped up. So what you're going to do is literally breathe out, breathe in, 2 seconds in, 4 seconds out, and you're going to repeat 10 times to help manage your perception of stress. Number 4, guess what? an awkward position while you're sleeping. You want to make sure your head is actually supported. So when you're doing one of these, you need a pillow that actually supports your head for sleeping. So if you're in an awkward position, you may be spending 6, 7, 8 hours a night in an awkward position where you are just like this, not properly supported. So consider, well, a great pillow, something to support your curve and not end up in an awkward position for those 6, 7, 8 hours at night. And finally, number 5, well, sedentary lifestyle, reduced movement. Guess what? You got to make it a point to literally get up every day. Well, there's in the morning, preferably in the morning, at lunch hour, multiple times a day, go for short bursts of walks. I just had someone mention to me the other day, they were talking about when they walk. They even had it down to when they walk, and they're trying to walk after their meal to help manage their blood glucose levels better. So if you're really going to optimize things, guess what? Eat your breakfast, go for a 10-minute walk. Eat your lunch, go for a 10-minute walk. But the sedentary lifestyle, immobility, doesn't do anything for the health of your joints and how you move and your health overall. So make it a point, in order for a joint to stay healthy, guess what? Ideally, it needs to go through a full range of motion every single day, preferably against some sort of resistance. So you can do a little checklist now. How much are you moving through a full range of motion with your body every day, every week? But sedentary lifestyle really does, well, guess what? It's connected with more chronic challenges, more chronic problems, more chronic neck pain. So there's a link there. So make it a point of, guess what? Walking multiple times a day. All you have to do is focus on getting your steps in and moving your body. So when you consider those 5 things, 5 surprising causes of chronic neck pain, do a little audit for yourself. And remember that many of these things, it doesn't come down to just getting old. It comes down to you taking action today. And I know as a busy parent, things can get distracting, but if you give yourself a schedule, if you give yourself some visual cues at the desk, it really can make a big difference. And remember that the health of your spine and nervous system is vitally important. Your habits throughout your day are vitally important. And just get yourself something simple like a band so that you can literally, guess what, do your exercises multiple times a day. And remember, like anything, consistency is key to help get you back on track. So I will leave you with that today. And of course, as I've shared in the past, if you're enjoying this, please take a moment to subscribe, like, and I can't do it alone in terms of the mission is big, in terms of helping people understand their health, and they need more function for more health, and their spinal health is vitally important for that. So all I ask is take a moment to click share, send it off to your feed, or grab the URL, and if you think of somebody, send it directly to them so they may receive the benefit too. Anyways, thank you so much. I appreciate you, and I hope you're having a wonderful day. Bye for now.
Thanks for watching Dr. Matt's self-help videos. See you in the next video.